I'm live for my unscripted conversation where we talk about mental health. I am Richard the counselor, and we are here for Mental Health Unscripted, where we talk about mental health topics, and we just have this kind of fireside chat when I'm at least at home by a fire, which is not lit, so fireless fireside chat. And we are having conversations about mental health topics. I'll just make up topics if nobody asks questions, but mostly I'm here to respond to the chats for anyone who might decide to log in and join us for these 7 o'clock Sunday unscripted conversations. So we do that every 7. So if you're watching this and it's not 7 o'clock on Sunday, thank you for watching. And please tune in next week. Same bat time, same bat channel. This conversation is not, of course, confidential. It is, after all, on the interweb, where there is information readily available about everyone and you can stalk them. Yay, society. Hasn't done terrible things to our mental health at all. With that said, I won't be calling out specific people much, and I'll try to keep things confidential on the questions as much as possible. Because it doesn't seem like people can read the chats afterwards, so people that watch later, but I can't guarantee any confidentiality. So when you ask the questions, please do so with yay, bad internet. Yeah, and I'll get to your question in just a second. Please do so with understanding that it might be good to be generic. You could always say, a friend of mine has this issue, and no one will ever know that it's you because no one's heard of that technique before. Hi, I know you have some interesting opinions on autism spectrum. Ooh. Do you think ADHD is its cousin, the way people act and our thoughts on iodid? It sounds like when you try to say it as a word instead of a letter, it sounds like in Street Fighter, like that. The autism ADHD connection. Okay, so my thoughts on autism spectrum disorder, as it is called. So that is definitely the correct way to pronounce it. I'm on a train in NC, North Carolina, I think. Internet is sporadic. Well, it's good to have you join us. So I like the term neurodivergent. I think that eventually we are going to have more classifications. In other words, more divergencies than autism alone. I think that we have broadened the diagnosis of autism to the point that it broke. So this is part of the problem and why there's the ADHD autism thing that is really prevalent in the meme culture and the reels, and there's all this bad information where people talk about ADHD like it's autism and autism like it's ADHD and act like it's the same. There is comorbidity, morbidity. That's definitely not the right pronunciation. Morbidity, like morbidity bop. Oh my gosh, I'm blanking on that word now and how to pronounce it. But there is a correlation between autism. This is going to be a more of a chaotic one, I can tell you already, with my mental health talk and the morbidity. I know the word, but I can't pronounce it. Morbidity. Is that right? That doesn't sound right. Anyway, so autism and ADHD are co-occurring often, and that see, it's like everyone's, you got the word, you got the idea that I'm saying, but I think I'm saying it sounds wrong as I'm saying it. They coexist, they go together. You get the point. Thank you all for joining the chat, by the way. I really think that there's going to be you could say there's a pandemic on ADHD because we are not designed, our human brains are not designed for the internet-driven culture where we have flashes of images all the time. It used to happen just in advertising, which was already a problem. Now it's our reels, short form media content, which of course I produce. So I'm a little part of the problem, I guess. Yeah, I'm a little autistic myself. Not just a little autistic. It's funny, the autism is how some people pronounce it, and then old timers, right? Into Alzheimer's. Anyway, it's just mispronunciations. Point is, in understanding the thoughts between it, I would not say they're cousins. I would say they're just really popular topics to talk about that I don't think are well defined and are both very broad in diagnosis. So you could fit in anyone who's intellectually a little different into what is now a ASD. And you could fit in anyone who is a little different in ADHD because of how broadly it's put in. In fact, some people are even broadening hypo and hyper for ADHD in terms of the attention deficit hyperactive disorder, attention hypoactive disorder, which is literally the opposite of hyper. And why does these things happen? There's going to be a lot of political debate about this, but I think it comes down to money somewhat. So the broader your diagnosis is in the research field, the more money you can get because the more people have that disorder. So that's my little jaded perspective on this. Where it matters is diagnosis is designed to guide treatment. Diagnosis and ACT talks about this really intelligently because we use diffusion. So we see ourselves through the lens of context rather than content. So in general in life, I don't see myself, I'm just thinking of this because there's a cello in the background, which I don't actually play cello for those who are curious, but I don't see myself as a musician, but I am somebody who can play music. Seeing my identity as a musician is self as content. I identify myself based on the content of my life, which has a lot of negative effects. Yeah, big pharma is part of the problem for sure. Whereas self as context means I can be somebody who plays music, right? That is something that the context of my life can include, which develops psychological flexibility. So the ACT approach to diagnosis is I am not a disorder. I am not autistic. I may have symptoms of autism spectrum disorder. I am not ADHD. I know people don't say that, right? But I might have symptoms that fit with ADHD, right? I am not depression. I am depressed is not a good statement. I have feelings of depression. I have symptoms of depression, right? This also helps you avoid permanence and personalization. So you're not identifying yourself with the disorder and you're not seeing the disorder as permanent. If you're trying to get a new story where you develop a new identity in your life, then overly identifying with the diagnosis is not helpful. So there's a lot of people that find it cathartic to go, oh, I'm not broken. I have this disorder and I don't want to rob them of that. I'm not saying that these symptoms aren't real. One thing that I did mention in another unscripted conversation is that if you're not having it be maladaptive, in other words, if you have stuff in your life that isn't negatively affecting your life, it's not a disorder. So you wouldn't be diagnosed with it. Now anybody can throw you a diagnosis and call it a day, but you technically only have a disorder if it's causing disorder in your life. And that disorder is designed to guide treatment. I think I've answered the question thoroughly enough, but would you approach a chronic illness the same way? No. So there's a big difference between a chronic illness. Now, there's going to be, with chronic illnesses, problems with personalization and permanence. But there is a somatic, which is the body, right, cause for something that is a chronic illness. So this is why we actually don't use the disease model anymore for mental health. They still talk about it sometimes, people, that is, like we use the disease model, but that has been, the disease model has been extinct now for a while in the mental health. So in other words, like you'll still hear people say, Statements like depression is caused by a chemical imbalance in the brain because they have a lack of serotonin. Yeah, this is debunked. That is the term that I was looking for. Thank you. That is from the disease model. There was a time period where we were saying that because that's what the evidence at the time seemed to be indicating. And that's later been debunked by more research. Is there a connection between serotonin and depression? Absolutely. And that's why SSRIs or the antidepressants work the way that they do, where they can help people. But there's a huge difference between chronic illness that is physical and something that is either psychosomatic, which means it is presented in your body, but the primary cause of it is in your mind, and something that is in your mind at all. So the mental health, all the DSM-5 stuff, all the diagnosis that counseling primarily deals with should not be chronic illness, which is why I don't like how we talk about ADHD, because I have, for instance, a niece who has what's now called profound autism, which I don't like that name. And it would show up in a brain scan. Like she's got, mental health issues, not mental health issues, physical issues in her brain that make it so that there are behavioral therapies that'll work for her, but it's not like a thing of like where she could do ACT or EMDR and then improve her life. Right. So it's technically not something that, in my opinion, should be covered in the DSM-5. It's something different. So that's my hot take. ASD probably should be a separate diagnosis than autism, profound autism. Like it should be considered completely separate. And they called it, hold on. It was a German guy's name, Asperger's. But that was done away with. That was no longer in use. All right, so keep the questions coming. In chronic illnesses, there can be a mental health link. I had migraines that were caused more by stress and diet than anything. But there was definitely a mental health aspect of I feared being healthy, and it did help me going through that process. My brain scan was clear. That doesn't make sense. What do you mean? You're going to have to, if you want to talk about it in the chat, I'm going to need a little more details about what you mean by, are you confused why your brain scan was clear because you think you have a physical thing? I heard a nurse recently advocating for preemptively giving SSRI to organ transplant patients because risk of depression is high. That is terrible. That is a very big pharma attitude in a field where it does not apply. Anytime you try to hack the brain, there is a cost. I'm not anti psychopharmaceutical drugs, but I will say there's always a cost. There's always a symptom. Pretty sure I'm crazy, but clear scan. So, okay, so this is clear scan means no problem in the brain. It doesn't mean no problem in the mind. Now, mind is matter too, just not matter that'll show up in a brain scan. We are working through cognitive behavioral therapy on our mind and developing skill sets in our mind that'll help us deal with depression, anxiety, deal with struggles, and deal with our body in terms there in ways. I mean, our body does, I'm sending the signal into my arm to raise from my mind. My mind is deciding to do it. It goes then into the brain and it sends it out. And our whole system works that way. So it's all interconnected. But there's a big difference between something that's a problem in the body and something that is a problem in the mind. And they just work on different principles. SSRIs should be a last case use in my mind, and should be done with treatment. And all the research shows that SSRIs or antidepressant medication works better with therapy, right? So for one, they should be taken together. and it reduces its effectiveness over time, whereas therapy increases its effectiveness over time. So you can absolutely say I'm biased, where I'm a therapist and I'm saying I'm pro therapy over just taking a pill. But you can also do the research yourself. There's always risk. There's always symptoms of any kind of medication that you take, and they work best together. And you do build up a tolerance to any medication, so its effectiveness becomes less and less over time. Whereas the skills that you do in therapy, the effectiveness actually becomes more and more over time. Giving the SRI to a recipient or donors, that doesn't make sense to me. In my mind, you would be grateful to the donor, and donors wouldn't do it without wanting to. I think the idea is it's preventative, because like a lot of people struggle. So it's like, it could be the same thing. You could go, we're going to give women who just gave birth to a child SSRIs automatically, because so many women struggle with postpartum depression. And so we're just going to preemptively do that solution. I mean, it's like, why not just go, well, let's recommend therapy to all the patients and work on that. Somebody's comment was just there. That's it. So I think there's more. They are. She was saying risk of post-op depression is receptance is high. Yeah, and I get it. And like, okay, let's inform the clients of the high risk of depression and advise the safest route that is clinically, that is evidence-based, which is therapy. And then the therapist can then recommend them seeing a psychiatrist if they are struggling with depression to the point that they need some medication help as well. And I'm not against somebody going on medication. I'm not, I mean, against anything. I mean, you get, it's your body, your life, right? But if you're going to do it, it's great to have a plan. It's great to have therapy. It can be easier to therapy is tough, right? It is, like, no doubt about it. There's no easy way. You can have a therapist like me that makes it super fun and it's a joy to come in every week, but there's still hard things that we have to talk about to get to have it be effective. And so having the aid of, especially if you're like in really difficult depression or anxiety, that's really acute anxiety, it might be hard to process at that moment. So we might have to, take a pill to chill for a little bit and find what are the natural remedies for such instances. Yeah. So like, I'll tell you too. And it's like, I might sound a little bit like a holistic healer kind of mentality of hippie stuff when I say like using food to heal is huge, but it's just true. Like there's so much about our health in general, physical, emotional, I'd even say spiritual, that comes down to what we eat and what we don't eat. And so I think a lot of these things are food related too. I know mine was. So unrelated to my experience as a therapist and all I know as a therapist, I was in chronic pain all the time. Now, it was related to therapy in that I had stress problems that I eventually got better with going through therapy. But I also had, this chronic migraines that was basically sugar related is the shorthand version of it. Like I could go through all the science of what happens in my brain, and it's fueling irregularities that causes migraines, because it is more complicated than that. But if I exercise regularly, I fast regularly, I don't have migraines. So that's my personal formula. I'm not saying everyone needs to do that same thing. Please don't. It might be too healthy, too extreme for a lot of people. But there are certain ways that we can adapt with food and nutrition that will really help with some of the physical stuff, some of the emotional stuff, mental health stuff. I tried to stay against the grindstone. Yeah. And that's helpful too. For example, I had a really bad GI issues recently, and the specialist gave me an entire battery of tests and wanted to give me meds, but never once asked about my diet. So my dad, now this is 1970s ish, somewhere around there, that he went to college at the University of Michigan, which is one of the highest like esteemed medical places. Okay. Now he wasn't there for medicine. He was there for gym, also known as kinesiologist if you want to be fancy, but he was a gym dude. And he was in an hour seminar and he said, the professor said, pay attention, doctors, because this is the only hour you'll get in your entire education about nutrition. Now, he had gotten many classes about nutrition as a kinesiologist. There was one, now it's better now, but there was one class at that time. So doctors that got their degree in that time period, right? The doctors that are still practicing, and there still are doctors that are practicing for that time period, got 1 hour seminar on nutrition alone. So it's like, there's different people that are experts in everything. Doctors aren't experts on everything. They're experts on some things, the things that they do. I had a doctor suggest anti-anxiety meds for GI issues. I had a doctor for my, it's terrible. I went in for a migraine and he gave me, what he said was, one pill to help prevent migraines, and then one pill that when I already had migraines to take. This was off label. I found out only when I did my own research afterwards. And what it actually was a antidepressant medication that caused seizures and an anti-seizure medication that he was giving me. I also was able to find out online that right now those drug companies were giving kickbacks to the doctors for prescribing it off label. And I was pretty young at the time. So my dad was really upset and he called the doctor, and the doctor, like, there's nothing illegal or unethical about what I did, try to defend himself. It can work in this case too, but he basically was, without ever telling me, off label, giving me an antidepressant medication for a migraine. And it was basically like, oh, well, you struggle with migraines. So, well, we can't do anything about your migraines, but maybe if you take these pills, you won't be as sad about the fact that you're in pain all day. It's like, okay, it doesn't work that way. Just tell me you can't help me and then let me stop wasting my time. So I finally had a neurologist that did, actually. She was like, people that were born with migraines, we don't really have a lot of help for them. People that had it start at a certain age, there are things that can be done, medicines that work for it, medications. But what I end up finding is fasting and exercise were my combination. And I'm also a very dedicated faster. So I fully believe in I really believe in fasting everything at times, but going long periods of time without food can be very healthy, in my opinion. This is not medical advice, by the way. This is a therapy channel. It does have mental health benefits too. In vet med, we did off-label stuff often because it actually worked instead of the rep bonuses, and I loved it. Yeah, and there can be times when I go to hospital, I tell them my primary care physician and insurance providers are the same. Jesus, yeah. I'm sure they respect that at mixed intervals, or different people probably respect that and some people don't. I also had PC doc want to sneak in a prescription for depression meds for a GI issue, and I declined. Yeah. I will say we got somehow on the mental, or not the mental health, but the physical health doctor's prescription stuff a lot in this conversation, which is fine. But the one thing that I would say is, like, look everything up. Do your own research on what the medication is so you know what you're taking before you take it. So maybe you have a great doctor who's being perfectly honest with you. I hope you do. I'm not saying doctors are the enemy, right? There's a lot of good doctors out there, but there's not any harm to getting a second opinion or research on your own. So you look up something before you put it in your body. Before you put a pill in your body, make sure you know what it is and what it's going to do. But anyway, with any questions on the mental health side of it, I don't know if we should stay on the doctor physical. But the point of why I got on this topic was there's a big difference between something that is primarily psychological and something that is primarily physical. And they really do not work the same. Um, the reason we went with the disease model for a while is because it was to like kind of earn legitimacy and to not have people say, oh, your problems are just in your head. Like that's somehow less significant or severe or important or real, but those problems are just as real. Total random topic change. Something I find interesting is the way people can apple lots of mental health tools to specific categories and be self-aware, but other categories be very unhealthy. Apply. I bet it's apply. I'm such an Apple fanboy that I'm like thinking, how could they Apple their way to lots of mental health tools? Well, I use my Apple Watch to keep me motivated to move, and the Vision Pro for meditation devices. So yeah, Apple does provide a lot of mental health tools. But no, I think she means apply lots of mental to specific categories and are very self-aware, but other categories can be very unhealthy. Are you talking about me? Because that could be me, because I'm definitely that. I would say maybe that's the best of us, right? So like it's impossible to work on all of our mental health issues at once. And, we are all work in progresses. I have things that it is apply. I have things that I have really benefited from therapy on. It's like, okay, so this is a funny story. So I was giving therapy when I first started with clients, and I started to get jealous of my clients. I was like, I wish I had a therapist like me. All my clients their lives are getting better. They're doing all these exercises. They have somebody guiding them in the process. It's working for them. And I'm like, I'm so jealous of my clients. They're all happy. And then the thought occurred to me, it's like, Richard, you idiot, you could just do the things that you're telling them to do. And I'm like, oh yeah. So I started to actually apply the principles, and I started to get healthier in the categories that I applied them. So mental health does not just work as a fix-all. It's really, you go through a specific process on a specific issue, and then later another issue might show up, and then you have to do the specific issues on that. If you don't see something as an issue, I mean, like textbook me as a problem as a therapist, when I was the problem, some people have heard the story before, but I was talking to a therapist about my then wife and I when we were going through a divorce, and was like, what is your opinion? And he's like, you two are a very unhealthy couple. And I'm like, what you mean she's unhealthy? You mean like I'm healthy? I'm like the healthiest person I know. And I'm embarrassed to say it, but that was literally what I thought at the time. And, years of therapy later, I realized that I had a lot of issues that I was just unaware of, and in a culture in which it wasn't thought of as issues. The things that I do were thought of as healthy. And that's even what he said. It's like, you live in a culture that idealizes your worst traits. Visual what? Apple. So there's a thing called a Vision Pro that's like an augmented reality headset thing that can be used for meditation, relaxation. It can be used for a lot of things, but that's primarily what I use it for. It's pretty cool. It's ridiculously expensive though, so I don't necessarily recommend it, but it can be a mental health tool. The ego is the root of suffering and terminal uniqueness. So terminal uniqueness is a term that's used a lot of times in recovery circles. It's not necessarily something that everybody knows, but it's a really good, it shows up a lot in people that are still in denial of addiction, because they're like, nobody knows me, man. Like, if you don't know what I've been through, you don't know what I'm struggling with, nobody gets it. And so it's like, I'm not going to listen to you because you don't know what it's like. And so that's called terminal uniqueness. What becomes terminal about your situation is that you're so committed to have it being unique that you're not listening to people that can help you. So that's what terminal uniqueness is. I think that's a good description. And I am the one's disturbed MOFO, which stands for mutually objective friend on topic, who's been down with the sickness since birth. Yeah, I'm the one person. Nobody's like me. Can't be terminal unique when you're getting down with the sickness. Yeah, a lot of great references here. Down with the sickness. I don't think I cannot hear my brain say therapist in the Seinfeld way. We're making reference jokes all over the place, so sorry if you don't get them. But anyway, yeah. So ego. There's a book called "Ego is the Enemy." It's not a great book, but it's a great title. And the problem is, how do you escape from ego? And I thought about this a while, and eventually I came up with this solution. It takes awe. It takes basically attention being driven on something bigger than yourself. And this could be community, this could be nature, this could be God, this could be purpose, right? But if you're focused even on your own self-development, you could actually fall bigger into ego. And an overemphasis on ego is going to be a problem, which is also why I'm not a super big fan of even just self-affirming mental health exercises that can be helpful in certain circumstances, but can also be harmful in certain circumstances. I didn't do an impression. See, I avoided it. Look at me, growth. I call that growth. But anyway, so if you are someone who struggles with self-esteem, and then you decide to fill yourself with self-ego, right? Self-affirmations, you could fall right into arrogancy. It's surprising how this is true, but I found it true again and again with dealing with clients, that sometimes the step between self-loathing despair and arrogant narcissistic like behavior can be in a sentence. It can be a moment. Like, we can switch like that between one and the other. We can literally bounce back and forth between the two. And the healthy thing is actually what I would say in terms of self. And we kind of talked about this last week a little bit with the what do you rate yourself 1 through 10, and what is the ideal? Because it's not 10 and it's not 1. It's self-awareness. It's to be able to look. Well, it goes back to that self as context and self as content. Let me know if you understand what I'm saying when I say self as content and self as context in the chat, because that is not a concept that I understood for the longest time studying ACT. So I really wanted to get this concept, and it was just right beyond my grasp. And I feel like I understand it now, but I don't know if I'm explaining it well. Because understanding this idea of, I reject every title, even that of the good man. I could be somebody who does brave things at times. I could be somebody who's scared in certain situations. And I want to be self-aware and flexible and not see myself as a diagnosis or see myself as an identity, right? Does that make sense? The self as context? Let me know if you get it. True humility exists in the moment you speak of. True humility exists in the moment you speak of, in the moment of awe. Yeah. Today I'm a 7, right? I think actually 7's a pretty good number. Right? Because it's I'm not in the delusion of thinking I'm a 10, but I know if I'm being honest, I'm better than average. Why do I think I'm better than average? Because I'm working on myself. And that's what makes me better than average. And when I'm not working on myself intentionally, I'm probably going to slip into average. You could maybe explain it more, content versus context. Yeah. Okay. So if I see myself as a mother, which would be an odd thing to see myself, I don't know why I picked that, but let's just say, well, it happens a lot that a lot of women clients that I have over-identify the aspect of themselves as mother, who I am as a mother. Then my value becomes how good I'm mothering. Problem with that, and there's a problem with over-identifying any content, but especially the mother one, is that, well, your kids have choices, and those choices are not really on you. You can provide a good environment and do all that you're supposed to. But if your fear is that if you're a bad mother, you're a bad person because how you identify yourself is based on the content of your life, i.e., I am a mother, I am a good mother, right? Then what you do is you're too scared of being a bad mom, so you end up becoming an over-controlling or over-protective or over-enabling mother out of this interfere because it's all wrapped up in your self-worth and your identity. Rather than when you're like, yeah, one of the things that I am is a mom and it's important to me, but it's not who I am at my core because I can be different things at different contexts. So in one context, the relationship with my child, I am a mother, but in other contexts, I am not. You're actually going to be better at mothering because you don't wrap up all of your identity and your fear and all of drawing all your wounds in those issues. Does that make sense? So it's related to the idea of diffusion and not associating yourself. And let me know if I need to clarify what yeah. Joe's the one supposed to grab the cello. I did mention earlier that I don't play cello for those of you who see the cello in the background, so don't ask. But yes, you did forget the cello. So actually, that's so real that when I was pregnant, I grieved. I literally said, Gia's going to die. I'm just going to be her mom. Obviously, we got past that, but that's how people told me to feel. Yeah. So, I mean, whoever told you that is probably somebody who's stuck in self as content, your identity. And I've had clients that were like empty nesters and dealing with finding themselves after years of not being themselves because they over-identified with the role of being a mom. They're so felt this need to be the best mom ever. And here was the saddest part. This one client in particular I'm thinking about. She never was able to be herself around her kids. So her kids never got the pleasure of getting to know who she really was because she was so focused on playing the role that she thought moms are supposed to play that she wasn't herself. And she wasn't present in her marriage either. And her marriage ended up falling apart. So she lost her marriage and she was struggling with her relationship with her kids and finding herself for the first time as an empty nester in therapy. And thankfully she did. She got to know herself better and found joy and experienced life. But what a sad statement that like they didn't, because she's got a great personality. She was a wonderful woman and her kids never got to know that. That's what self as content can do. And there's a lot of bad examples of self as content versus self as context. It's like now we have freedom because it's like I can have a bad day. I can do something bad and my identity is not wrapped up in it. So it's also helps us with the growth mindset versus the fixed mindset. So self as content is a fixed mindset. I am these things, right? And I have these traits. Whereas the growth mindset is I am working on these skills at these moments. And then other times I'm working on these things and I can do this good and I can do this bad. And it's like, and there's all these different contexts and I am all of them. I'm not just one aspect of them, right? I think that's covered enough, hopefully. I told a chick once, you can't forsake yourself for the sake of being a good mom. Yeah. It's like really any role. Like, I don't care what the role is. I was a worse pastor when I was focusing on being a pastor more than I was focused on being the healthiest human that I could be and just learning to do it myself. And that's another question. This is a question I ask moms a lot. If your child was exactly as healthy as you are now when they're your age, are you going to think you did a good job? And like, a lot of my clients were horrified by that question because they're like, I want my kid to be so much healthier than I am now. I'm not healthy at all. And it's like, okay, well, the first way that we help people is by modeling. So we got to be healthy ourselves. I think I remember you saying one time, Tetris or similar things can help with trauma. Am I recalling that correctly? And why does that work? Okay, so that is a nice change of subject. So, the reason that Tetris works, and this is done with people that are called in after traumas, I can't think of the word, crisis counselors, it actually helps you focus on the different shapes. And since it's visual, so your problem is you will like replay the traumatic things in your mind in this time period that allows it to like then shape into what you think and how you feel. And so playing Tetris or a similar it's got to be a puzzle game that's taking your attention and your focus. There's a lot of really fun focus things, by the way, because you say, oh, you can't not think of a pink elephant, right? Because if you try to not think of a pink elephant, you're going to think of a pink elephant. You just got to, like, you could do math in your head if you like math. You play Tetris. You could think of a blue monkey smashing his cymbals and dancing, and now he's breakdancing. Oh, it's like, oh, look at all the monkey doing his tricks, right? And then the elephant's gone. So, like, if we're thinking about overthinking or stress, or our imagination can only be taking up one thing at a time. And so if you're focusing on Tetris and you're getting really into Tetris, and it's an easy thing because even kids can do it, then you don't even have to put any attention on what you're not thinking about because you're focused on something else. So that's the principle that can work with a lot of things. And developing what I call it is your spotlight control is such a big thing for mental health. Knowing how to control your spotlight, knowing how to hack your system to think about the thing that you want to think about rather than the thing that you're at default thinking about. Does that make sense? It's a form of EMDR. Not exactly, but I do think EMDR works with the same principle because it distracts people from their trauma a little bit. So it's at least my theory on why EMDR works. For those of you who don't know what EMDR is, it's eye movement desensitization, reprocessing. Rapid eye movement desensitization reprocessing. It can also be done with taps instead of eye movement. But basically, there's a lot of people that have a hard time going to traumatic memories, and EMDR gives them something else to focus on. And so their defenses go down just enough and that they can go there. Now, there's other theories on why it works in terms of like the right and left hemisphere and how it gets coordinated and synthesized. But we know that EMDR works. There's a lot of research that shows it works. It's not a magic bullet. It works as well as ACT, as well as CBT in most cases. But it's a great technique. I'm a fan. We don't know why it works. I think that is just literally giving somebody a framework to process, and a distraction that puts their guard down enough will help them. Do you have tips for people who struggle with balance? I like using one of those like half circle balls things and just kind of stand on it on one foot. Putting my arms out helps. Although I'm not sure that's the kind of balance. Wearing New Balance shoes. There you go. Joe's on the same line as me, the literal joke. I don't think that's the kind of balance that you're asking for, so you might want to be more specific. So I, a lot of times, am somebody who learns as a pendulum, right? So I'll go from one extreme to another. And I've tried to adjust that to micro changes. So if you want to actually achieve balance on anything in your life, and you're going pendulum swing, pendulum swing, think about a physical balance. So I have a slack line that like is literally one of those like tightrope kind of things. And when you're first starting, that is what you do. You do these big things, but as you're learning to balance, it's like this, you can't even see it. Or handstands, even a better example. So you will immediately be better at handstands by, instead of when you put so say this is the floor, when you put your hand down, instead of putting it down like this, put it down like this, okay? Just a little bit of extra space. Why? Because it gives you that room to adjust with those micro adjustments, and it's easier to balance that way. So in the same way, with your relationships, your struggles, your different issues, just trying to just like tweak it a little bit and just keep tweaking it until you find a balance. So don't throw out all your friends and get new friends. Don't throw out all your habits and get new habits, right? If you're, gaining weight, don't throw out all your food and get new food. Like little tiny changes that are sustainable and that just gets you moving in the right direction so you can consistently improve your life, will actually help you get more balance. Got it. So slacking off helps with balance. Yes. Slack off more. Yeah. I do actually need to get my Slack offline back moving now that I mention it, because I haven't done that in a long time. And it is a great way to not only work on physical balance, but also to meditate and focus. And, it's just a nice little relaxing hobby. But yeah, slack off can help with balance. I wish one of my simple little mental health things that I advise people to do that I wish they did more often is nothing. Like not having maybe music playing, right? But other than that, no podcast, no audiobook, no dead scrolling, no Facebook, no TV in the background. Just sit there with nothing and watch what comes to your attention and just let it come, let it go, right? Think thoughts, right? This is how people lived for centuries, all the time. And now it's become a therapeutic exercise, and one that people find some of them horrifying and difficult, but it's the default of life. And, it's like, what relationships do you have that are healthy that you never spend time with one-on-one? Any? Then how do you expect to have a good relationship with yourself if you never spend time one-on-one just being with yourself, just practicing thinking and feeling and, being present in that moment? And if that's too hard for you, dance while you do it, because that makes it easier. My takeaway this week is just do nothing. Yeah, at least for moments, right? Take moments to actually do nothing, but like literally make it nothing. Don't fill it with stuff that will actually produce more ADHD symptoms. Announce ideas. Okay, so Joe is doing his 40th birthday is in 90 days from today, actually. And he's doing a rest and reset 90-day dedication, right? So he's dedicating the next 90 days for God. This is a mental health chat, so some people might not be in that God honoring boat, but that's okay. If it's meaningful for you and you do 90 days of dedication to rest and reset, that's awesome. So from today to Joe's 40th birthday, anyone who wants to join can do the 90-day dedication. And his is going to be about centered on rest and reset. So I don't like that person. The person you're talking about, Joe, because you just said you love him. That seems pretty schizophrenic. No, I think you mean the person that you're alone with. And yeah, that's not good. I know you, and you're a wonderful person. And so it's probably time that you are introduced to yourself and get to know why other people like you so much. So let me introduce you to you and tell you that this is somebody that I think you should be friends with. I think that you'll like this person if you get to know it. I remember my mom said it. I don't think anything brilliant about what she said, but she just at one point said, it's a shame that you don't like yourself because you would if you met you. And that really did change the way that I looked at myself a little bit. Because I thought about it and I was like, if I think about it and I did meet me, I think I would be like, man, this is a cool guy. He likes cats. He's into hiking. He lives in a van some of the time. He does a lot of random cool stuff. He's kind of down for anything. He's all dedicated to self-improvement. This is the kind of guy I like. And then it's like, wait a second. Why am I constantly belittling myself and saying negative things about myself if I actually like me? And then it's like, oh, so I do like me. I just treat myself like crap. So I have a habit of being emotionally abusive to myself, which I developed as a coping mechanism because I was bullied a lot as a kid. And so I bullied myself so I could be in the in crowd. See, that was the way I did it. It's like if I'm making fun of me and everyone else is making fun of me, then we're all friends. We all agree nobody likes me. And so that's what I did. And I kept that lifestyle out of hating myself for decades until I finally realized that I needed to change my ways. And changing it takes time and it's difficult, but I'm doing the work. So cool. We got some people in on the 90 days. Everybody loves Raymond and Joe. All right. Got any more questions for me, chat room? Mental health chats. Let's keep going. The man in the mirror is the man I must love if I would love to be loved. Yeah. And the exercise, so it's like, what do we mean when we say loving ourselves? I don't mean just speaking kindly, but that helps. At least not speaking abusively would be a good step in the right direction. But I actually mean taking care of that person, right? Treating that person with respect and investing in that relationship. But like I said, going back to that whole spending time with you can be such a big thing. And just with you, right? And you can do stuff. It doesn't have to be like where you're just sitting there doing nothing. Like you could go paddle boarding with you, right? I wouldn't say like go to the movies with you, because again, then your attention is all on the movie. It's got to be something that your attention is somewhat on your thoughts and feelings, which is honestly why people ask me, like, how can you just run for hours? And some of the time I'm running with friends that we're talking, but some of the time I'm just sitting there, or well, not sitting there, I'm running there with my thoughts and my feelings. And it really helps me meditate. And it's something that I can do that's meditative, that's a lot easier than just sitting down for me. Like I like moving. So that's why I said dancing. I'm going to go back to that a lot. I'm a dancer. What can I say? But that can help you just be. Now I'm singing Love Yourself by Bieber in my head. I don't know if I know that song. I'm not a Bieber. How do you say the believer? I don't know how to say the fan club of Justin. I'm not disliking the guy anymore or anything, like as a person, human being. I think he needs therapy, be honest. But I don't really know his song, so I'll have to look that up afterwards. The only time that I can remember ever hearing a Justin Bieber song is when there was a video where, oh, now I'm blanking on the guy. Okay, who did who's the guy that did the video? Somebody called him Justin Bieber and thought he was like a kid thought he was Justin Bieber, so he did the song. Uptown Funk guy. Who's the Uptown Funk guy? Man, why am I blanking on the name? Belieber. Yeah, I'm not a believer. I know you probably have Bruno Mars. Yeah, Bruno Mars. Somebody thought Bruno Mars was Justin Bieber, so he did a Bieber song. It's the only time I've heard a Bieber song that I know of. I know you probably have many, but can you think of any small like family traditions or something that seems small but made a large mental health difference for you, or things you think most people should? Dinner. Having dinner at least once a week around a table was huge. And my dad would have, I actually think this is really cool. He'd have this tradition where we did two things that were like good things from the day or the week, and one thing that we struggled with. And that both gave us permission as a family to talk about topics that were hard and where we were struggling, but also gave us the spotlight exercising of focusing on the good rather more than the bad. So it was a good balance, I thought, for those conversations, to have some things that were struggles that we could talk about, but some things that were good things and more of them. I'm looking forward to all the new stuff I'm going to figure out about me. That's awesome. For the first time in my life, I've been on my own, no spouse, no kids. Beautiful gift, a hard gift, painful gift, self-improvement course that people wouldn't sign up for, but you know, can lead to I mean, it's like my life is not perfect and I'm not perfect, but my life started to get better after I lost everything because I started to work on myself. And I'd been working on other people and trying to help other people, thinking I was healthy and not actually doing my own work. So, man, am I glad that I lost everything for that reason. What would be one thing you could do to help you fall asleep? Sleeping. Yeah. Take a pill. Um, so I would say a routine would help. So having a routine of what you do to fall asleep, whatever that routine is, your brain eventually gets used to it and falls asleep. There's a lot of different techniques. Having a consistent time that you go to sleep is good. I'm right now thrown off because I got sick. So my system is all thrown off. So I'm having a hard time figuring that routine back out. But I need to also like get back on all of my stuff. So I'm going to fast tomorrow if anybody wants to join me. And that's going to help, I think. And start working out regularly also helps me sleep. So those are the things that work for me. I have a few questions. What does accepting yourself look like on hard days? How do you show yourself compassion when you're struggling? And what part of yourself are you learning to stop apologizing for? All related and great questions. So, like, jumping to self-love can be too much too soon. And it can be helpful to start with just self-acceptance. And you could do this energetically. Like, you could literally just well, okay, so I happen to know this is Happy Hooves that asked the question, so I'll say that. And that's a place where they do therapy with horses. A horse is a horse, of course. You can't ask a horse to be not in its nature. It's going to react to the energy that it's given. It's designed to do so. So are you. I mean, not a horse, but you're reacting to the energy in which you are given. And so it's like asking a horse to be different and trying to force it to something is like what you're doing to yourself when you're trying to force yourself to work hard when you really need to rest or to be better, work harder, no one cares, that kind of mentality stuff, right? Work with yourself like you'd work with an animal, understanding that it is its nature. If it's injured, it's injured. It sucks, but that's where it is. Right? If it needs to go slower, it just does. And you work with it. If you beat it, it's going to come at a cost. It's going to worsen your relationship with that animal, and it's going to be to the detriment of the animal. It's not that it's not giving enough. So if you just accept that it's not that you're not giving enough, humans think that they're just not enough or not trying hard enough. And it's usually that we're just working against ourselves rather than with ourselves. One day I sat in my living room and felt sorry for myself for over 30 minutes straight until my mind finally came up back into my mindfulness. No TV, no phone, just me and my feelings. Yeah, and that's another thing. So that's the part that you should actually trust your feelings to the process. Don't trust the opinions that your feelings react into, but trust your feelings to just be feelings that you can sit in, process through, and you won't get stuck in them. So that's what I mean by like, don't trust the thoughts that come during those feelings. Just allow yourself to feel and trust that you won't get stuck in that forever. And that's another thing that'll help you with that self-acceptance stuff. Okay, so that's our hour. We're at time. So if you got more questions, tune in next week. Same bad time, same bad channel. Live at 7 for our unscripted conversation. I really appreciate everybody who showed up in the chat. Thank you. Would love to see you all next week. Tell everybody, tell all your friends about our chats, and let's keep building this mental health one day at a time. All right. You're all very beautiful. I love you all. All right. Have a great night.